Good evening, Honorable Chairpersons and delegates. My name is Dr. Vedant Gurav, and the topic of my presentation today is Post-Thyroidectomy Hypomagnesemia, a prospective study in a tertiary care center in central India. Total thyroidectomy has been advocated as a procedure of choice for a number of benign and malignant thyroid conditions. The most common post-operative complication following total thyroidectomy is hypocalcemia. Now, hypocalcemia results as due to decrease in parathyroid hormone levels, which is caused by an inadvertent removal of parathyroid glands during the procedure, or injury to the parathyroid glands during the procedure, or injury to the vasculature of parathyroid glands. Serum magnesium levels affect the level of parathyroid hormone by causing either decrease in secretions at the source or inducing an end organ resistance to parathormone. The aims and objectives of my study were to study the variations in serum magnesium and serum calcium concentrations after total thyroidectomy, to determine the presence of hypomagnesemia in patients undergoing thyroidectomy and evaluate the relationship with post-operative hypocalcemia, and to correlate the role of magnesium in biochemical and symptomatic hypocalcemia. It is a prospective study. All patients presenting to the OPD and undergoing total thyroidectomy were included. The duration of the study was 1.5 years. The number of patients that we studied were 36, and serum calcium and magnesium levels were measured preoperatively and 24 hours postoperatively. The reference values taken were total calcium level 8.5 to 10.5. So, patients having calcium levels less than 8.5 milligram per deciliter were considered hypomagnesemia. The patients having magnesium levels less than 1.7 were considered to have hypomagnesemia, and clinical findings suggestive of hypocalcemia, such as the symptoms of perioral numbness, paresthesias were recorded, and signs of Schwastek and Trousseau's signs were also recorded. The inclusion criteria: patients undergoing total and or completion thyroidectomy, having preoperative normal serum calcium levels and normal KFT, and patients willing to participate in this study. However, patients undergoing hemithyroidectomy were excluded from the study, and patients having preoperative deranged calcium or bone diseases were excluded. All the patients undergoing total thyroidectomy were included. My observations: most of the patients present in the study were of the age group of more than 50 years, followed by age group of 20 to 29. After total thyroidectomy, 39 patients, around 39% patients exhibited hypocalcemia, that is post-op calcium levels less than 8.5. This is the graph showing pre-op magnesium levels, that is out of 36 patients, 4 patients had hypomagnesemia prior to the procedure, and out of those 4 patients, 3 out of 4 patients developed either biochemical or symptomatic hypocalcemia after the procedure. 16 out of 36 patients, that is around 44% patients had magnesium levels less than 1.8 after the procedure, and out of these 16 patients, 13 patients, that is around 81%, developed either biochemical or symptomatic hypocalcemia after total thyroidectomy. Overall in the study, around 30% patients showed symptoms of hypocalcemia on post-op day 1, and signs of hypocalcemia, that is Trousseau's and Schwastek signs positive, were recorded in around 26% patients. In the discussion, the overall incidence of hypocalcemia in our study was found to be 38.8%, and hypomagnesemia was 44%. This is overall in 36 patients. Symptoms of hypocalcemia were seen in 30.5% patients. The incidence of hypomagnesemia prior to our study was found to be in only 4 patients, that is 11%, out of which 3 patients, that is 75%, they developed hypocalcemia after the procedure. And as discussed earlier, 13 out of 16 patients, that is 81% patients, presented with hypocalcemia after the procedure. Comparing our study with the previous recorded studies, The incidence of post of hypomagnesemia was somewhat comparable to study conducted by Chincholikar et al. And Pongalkodi Karunakaran et al. Whereas the study conducted by Anish Jacob showed a higher incidence of hypomagnesemia, that was 70%. I'd like to conclude by saying there is a definitive association of hypomagnesemia with hypocalcemia after total thyroidectomy, and hypomagnesemia can serve as a predictor of hypocalcemia in patients undergoing total thyroidectomy. These were my references. Thank you so much.
I would requesting Dr. Amit Pradhan sir to hand over the certificate to Dr. Vedant Gurav. Next is Dr. Aniket Daund.